I am commonly asked how I got here, how I started practicing this way, how long I've been practicing. I don't get quite as often where I went to school. That was a little bit more early on in my career. I'm Dr. Bamonte. I've been practicing for over a decade. And back then, I graduated in 2014, I was asked a lot where I went to school and how old I was. I actually almost got asked that every exam for my first 2 or 3 years in practice. I guess I didn't look old enough to practice, which I feel like is a beautiful compliment. And how I got here to be the veterinarian I am and to practice the way that I do may surprise a lot of people because it wasn't this very linear path. It kind of just organically happened. And after I graduated vet school in 2014, I didn't stay in one hospital for years. In fact, it's quite rare to have a new grad stay at the hospital that they start at. That is just statistically speaking. I admire and adore the hospital I first worked at. I worked at a hospital in South Georgia, in Cairo, Georgia, and did true mixed animal practice. True large animal, true small animal. It was a true mixed practice, did emergency. I had really great experience and really great mentors. 6 years into my career, was it? 6 years into my career, I became a relief veterinarian, aka a travel veterinarian. And over the years, I've had the privilege to work in more than 100 hospitals. In fact, if I had to guess right now, I'd say 150 different hospitals across various states, various different income levels, various different, very rural to very urban, very small to big corporate hospitals. And every hospital is different. Every team is different. Every clientele is different. Every doctor practices differently. And every client is going to have a different experience because of that. Meaning I'm going to have a different experience because of that, as going into different hospitals, different tools, different skill sets, different things that I have access to. And working in many hospitals has given me a perspective that maybe a lot of veterinarians don't have. And I see it as a really good thing. In fact, I get asked now, if you're doing so much of these virtual consults and you're doing these holistic in-home vet visits, why are you still doing relief work? And I'm going to be candid with you. I'm not at the place where I feel comfortable to completely abandon relief work financially just yet. I'm almost there. And there's some hospitals that I have been providing support to for 6 years now that I'd love to still help them out when I can on occasion if it aligns with my schedule. So I don't know that I will completely abandon that until God tells me that I am on the next chapter of my career and when things look differently and different doors open. And so right now, it is a service that I provide. It is not nearly to the extent that I was providing before, but being in so many different hospitals in so many different settings has allowed me to see a variety of things, again, that I feel like most veterinarians don't because of that exposure. And being in some hospitals that specialize in certain aspects have really cool aspects and rehab facilities. It has just opened my mind. And it's taught me that there's rarely just one right way to practice medicine. In fact, I heard this example, I don't know, 1 or 2 months ago from someone I greatly admire in a sales space. And she was talking about skill versus technique. And that, like, for example, if you had 5 chefs, they all have probably a very similar skill set. They can cook, especially if they're the similar types of chefs. Maybe they're doing certain types of cuisine. But they each have their own technique in how they cook. Like if you gave them all a steak or you gave them all eggs and you told them to cook something, they're all going to have their own technique. They may include crushed pepper or garlic or butter or olive oil. They're all going to do it differently and they're all still right. And there's more than one way. As I even say in my consults, there's more than one way to cook an egg, right? We can hard boil it, we can scramble it, we can omelette it, we can do an omelet. We can do an omelet, we can do muffins. I mean, there's so many things that we can do with them. And I want to share some of the biggest lessons that I have learned from these experiences along the way and how I extrapolate it, how I implement it into my practice and patient care today and what that means for you and your pets. So truly, taking a step back, I really think that every veterinarian really wants to help. I truly do. I feel like that's why they joined this career and went through the schooling. And I think there's misconceptions that veterinarians don't care sometimes, that we're in it for the money. And I can promise you that's not why we're in it. I do have a different aspect and outlook on money, that I think that money is the transfer of belief because of sales. And that when you are doing well financially, it means that you're helping a lot of people and you're helping to solve a lot of problems. And so I have worked alongside probably hundreds of veterinarians now, from new grads to retirement age to just doing surgery to just doing ultrasonography to doing general practice, emergency, exotics, you name it. And I have seen doctors stay after their shifts. I've seen doctors come in early. I've seen doctors not have days off for weeks. I've seen them skip lunch. I've seen them miss family dinners, cry after difficult cases, scratch their head, celebrate miraculous wins or surgical outcomes, lose sleep over the ones that we or they couldn't save. But overwhelmingly, a lot of us really, really care. And if you've ever left an appointment feeling frustrated or maybe they didn't care, I hear you and I see you and I understand. And I hope that you'll remember that on the other side of the exam table, so where usually stand on one side and we stand on the other, there is someone who chose that profession because they wanted to help animals. And not to say that along the way they've not gotten burned out, which I feel like I can include into this, is that's why I think sometimes there is burnout in veterinary medicine, is there's a lack of alignment. There's a lack of actually curing rather than just managing. And there are some conditions that we can't cure. We have to manage. But I think that leads a lot into it. And that's why I've kind of have carved my own path, is that this is how I feel aligned and I don't want to get burned out. And being in alignment is a great way to help me prevent burnout, which means I can be present and ready and excited for pets and pet parents just like you. And so one of the biggest things that I have learned from doing all of this the past over 6 years of traveling hospital to hospital and state to state is that the biggest limitation is not always medicine, and it's time. Sometimes it's literal time for appointments, and sometimes it's time that we didn't see your pet in time to help them. And so appointments that are scheduled for 10 or 15 or 20 minutes, I don't like putting myself in those environments for hospitals, because I feel like I can't connect with a pet parent in that amount of time. I can't communicate what I need to, even on a healthy pet that's there for vaccines. I want to be able to talk to this pet parent, because if this pet's 10 years old, do they need these vaccines? What are their exposures? What is their lifestyle? And also talk to them well beyond just the vaccines: nutrition, lifestyle, mental enrichment, nervous system regulation, inflammation control. And so when those are that short, I find that I'm not put in my best environment. I want to review the history. I want to perform the physical exam. I want to communicate with the pet parent. I want to communicate with my staff and not put extra pressure on them. I want to prepare treatment plans. I want to sometimes help deliver really good news. And if it's bad news, I don't want to feel rushed. And it's really incredibly difficult to provide those deeply personalized, intentional plans when time is of a constraint. And that realization really changed me. Luckily, I never worked on staff as an associate. So I was staff as an associate, meaning I was on staff full-time doctor at one location for 3 different hospitals in my career before I went off to do relief. And luckily, none of them did 20-minute appointments. And I've relieved at places that have done 20-minute appointments. I think I've done 1 or 2 at 15-minute appointments. Didn't realize that until I was there. And I was like, this is not for me. It's not to say, it's not for me. In fact, I've done a podcast episode on it and why I don't feel like it's for me. And I don't want to spend my career just chasing the next symptom and just chasing the next Band-Aid prescription, because we just have to keep moving, because we have to keep the doors revolving. Now, it's not to say that sometimes I'm like, hey, I know you have concerns with X, Y, and Z today. What we can do is we can address X and Y. Z, unfortunately, will have to come back because the time is not allotted for that today. And it's not that I don't want to treat it. I just feel like we're doing you a disservice by doing a drive-by treatment for it. I wanted and I want the opportunity to slow down, to listen, to educate, to sit with my patient, especially when they're nervous. I love sitting on the floor with nervous pets. As long as I feel safe, which 9 out of 10 times I do, let me get down on their level. Let them get used to my smell, my energy, my vibrations, my voice, everything. Let them get used to it. And sometimes they warm up from that. And that desire is one of the big reasons I eventually built my holistic in-home vet visits. I want to be able to literally sit down. In fact, yesterday I was with a pet parent and I originally sat down on one of the recliner chairs and I was like, this is not where I need to sit. I want to sit on the floor. I'm going to put my computer on the coffee table and I want to sit. And so when your pet comes out and they're ready to greet me, I'm closer to their level and they can approach me and it doesn't look like I'm towering over them. And that's why I built this, is I wanted longer appointments. That's why my holistic in-home vet visits are an hour. And that's not 30 minutes with my technician and I swoop in for the last 30 minutes or the last 20 minutes. That's an hour with me. Not to say that if, when she's with me that she's not going to be facilitating or helping with some of the visit, but that is an hour with your doctor, with your pet's doctor. And I've learned that there's rarely one right answer. There's rarely one right path. Now, there may be a path that dominates in a more ideal over the others, but one of the greatest gifts of working in so many hospitals and seeing so many different veterinarians practice and learning from so many different teams, especially on similar cases, is that there can be 10 different doctors and they can recommend 10 different plans. Again, it's skill and technique, and several of them could be appropriate. Several of them I'm like, oh my gosh, that one pearl is something I'm going to take away. I remember years and years and years ago working at a hospital for relief and hearing doctors talk about dogs that are coughing and acid reflux. And I was like, oh my gosh. And it was just the way it was portrayed and delivered that it stuck with me. Because medicine isn't always black and white. It's about weighing risks. It's about looking at the patient in front of you and not worried about what box we're trying to fit them in. It's looking at that pet parent that comes with that pet and looking at them too, again, and not putting them in a box. It's individual pets. It is family goals, and it's the information available at the time that we have. And what information can we gather? What are the expectations that they're hoping to get? How can I meet those expectations? What's the timeline of those expectations? Can those expectations even be met if we had all the time in the world? So this experience has also taught me humility. It has reminded me to stay curious, to get curious with pet parents, to continue to learn, and to remain open for new evidence and new perspectives. And if it's just new, it's like, okay, take this with a grain of salt. How can I keep evaluating or using this information? Because pet parents want to understand and they want to be understood. And so that is something I've realized over the years, is that they don't always just want instructions. Yeah, sometimes they just want to just tell me what to do. I hear that a lot from pet parents. Just tell me what to do. I'm like, and I will, but I want you to also know why. So that way, when I'm not with you on Saturday afternoon or a Monday night, you know how to process these thoughts and work through these things, because I want you to feel empowered. Why is this happening? What is this medication for? Is this a Band-Aid or is this a tool in the toolbox? What is this medication? What is this food? Why this food? Why this test? What information is it going to give us? What are potential outcomes when we get the information? Because I have found that when pet parents understand the reasoning behind a recommendation, the reason behind a protocol or treatment plan, they become more confident, they become more bought in, more engaged, and better advocates for their pets. You become a better advocate for your pet. Because education isn't extra. It's not this like bonus. It's part of their healthcare. And it's part of communication. Because prevention also doesn't get enough attention. I wish that for as many sick pets as I saw in my practice and doing all these tests, that I had that equal amount of healthy pets that owners are like, yeah, my 6-year-old lab doesn't have ear issues, doesn't have poop issues, doesn't have skin infections, but I actually want to know now how healthy they are, so that, and I've been saying this lately and I love it, so that disease is not dictating the conversation later down the road. Because we are great at treating disease. Well, we're great at treating disease and managing disease. I've seen some stuff working at over 100 different hospitals, but sometimes we don't have enough time focusing on preventing it. So like, again, my mind always goes to why. Why are these things happening? The chronic ear infections, like why? It's just not, again, just because things are common doesn't mean they're normal. And so I'm like, how can we help this pet and how can we help them stay as healthy as possible before they're sick, or while something is abnormal, how do we prevent it from getting worse? How do we identify these subtle changes over time? How can we personalize this care instead of waiting until disease becomes obvious? Again, I wish, and I really think it is going to take pet parents seeing me with a pet that they're having an issue with, that they know that this is an option for them to consider it for their next pet before they're sick. And I wish people would start, I'm going to be honest with you, I wish people would start seeing me with puppies. I'm like, let's start now. Again, I can't prevent and predict that we're never going to have any issues, but how nice is it to know I've been doing everything I feel like, and sometimes it can be frustrating, right? When you're like, I did everything right and this still happened, but it's like, but imagine had you not done everything right, what would have happened and when it would have happened. And so how can we lean more into the prevention aspect as well? Because I see it all the time. It's very rare, I feel like, when I work at a hospital, when I fill in, again, doing over 100 hospitals, that I see a lot of, I don't diagnose healthy pet very often. It's a lot of diseases. And some of these are inevitable, right? Like calcified tartar periodontal disease. But I rarely do. And it's kind of shocking to me when I have a whole bunch of vaccines or wellness exams in one day, and rarely are they. I usually find something on exam, they're really overweight, or I found a new lump or bump, or they've got an ear infection. And I just feel like it's like kind of this revolving door of issues. And so that's what's led me to this holistic, integrative, functional space. And it's not because that conventional medicine is really lacking. It's because conventional diagnostics are essential. I think they're really helpful, right? Like wellness blood work, x-rays, ultrasound, urinalysis, cytology of masses. They tell us what's happening today. They tell us what's going on. But functional testing, or yet functional testing, can kind of let us know and help us better understand maybe trends or what's going on underneath the hood or behind the curtain, like I say, and maybe help us before that disease becomes advanced or their quality of life really suffers, including yours. So for the right patient, that information can really help us personalize. And when I say for the right patient, I really should say for the right pet parent. I think it's optimal for every pet. It's just, is every pet parent willing to commit? Are you willing to understand? Are you willing to ask the questions of why and to be handed the information when we get it? And something else I have noticed in working in over 100 different hospitals is that nutrition definitely deserves more attention. And the reason I say that is it is not uncommon. Now, I will say there's a caveat here, an asterisk, that if I've worked at a hospital before, they usually are great at learning, that I love knowing what my patients are eating when I see them. But it is very common that I've gone to a new hospital at least 50% of the time and I'm getting the history or the texts are like, this pet has gained weight or lost weight, or I noticed her, just so you know, he's a little bit on the well-loved side, or we got another ear infection, or we have another poop issue or anal glands. And I'm like, okay, what's this pet eating? Oh, they didn't tell me. I'm like, they're not going to tell you because pet parents don't always realize what's important information. That's our job to ask them and get this information out of them. And it really surprises me that a lot of teams aren't asking what they're eating. They're like, I don't know. They said this like blue bag, or they're not, or they don't know, and it's like, or what they were feeding last time. And you look and it's like they've changed every time. And so it's not given the attention that it deserves. And it influences every system in the body. And I've talked about this almost ad nauseum, that it is the one thing you can do for your pet's health that you can influence every single day, because you are feeding them every single day. It influences their skin, their digestion, their mentation, their anxiety, their behavior, their weight, their inflammation, their immune system, their mobility, healthy aging, their health span. It's not just about calories, not just about like, well, let me fill the bowl so they can just live. It's information for their cells. It's information for their body. Now, I wish I could say food cures everything. It helps a lot, but it supports almost everything. And we really need to be paying more attention to it. And again, me being able to do these virtual consults and my practice is that I am able to give nutrition the spotlight that it deserves for your pets. Because every pet deserves an individualized care plan. Because again, your pet is not like anyone else's. I guarantee you, even if you have two pets from the same litter, you know that they're not the same. I've even had some pet parents that are like, I had the yin and the yang, and they are litter mates, and they could not be more opposite. This one's anxious, this one's friendly. This one's picky eater, this one's not. And so we have to address your pet as the whole that they are, because no two pets are exactly the same. And that means no two pet parents are exactly the same. Two dogs can have the same diagnosis and need different plans. Two cats can have the same disease and need a totally different plan structure. Different lifestyles, different families, different environments, different locations, different compliance, different goals. Medicine works best when we treat the patient, not the diagnosis. and we look at them. We think of the diagnosis, but we think more of the pet. And that philosophy is what guides every recommendation that I make. Because collaboration makes the medication or the medicine plan better. Again, because we are personalizing everything, that allows for there to be more collaboration with that pet parent, because we're taking that pet parent, you, the pet parent, and your pet, that pet into account. And it's almost like we're looking at them as two unique beings. And because of that, I don't want someone to think that I always have all the answers. And that's why when people message me on social media and they're like, hey, what do you recommend for X, Y, and Z? And I'm like, hey, this is exactly why we should do a consult. Because what I may recommend for you may not be ideal for you and your pet, may not be ideal for you because of beliefs. I've had pet parents when I'm formulating recipes be like, please don't include pears. I don't like pears. I don't like handling them. And I'm like, okay, you've got your own issues with pears. Absolutely. I don't want to trigger anything here. Or I've had some pet parents be like, we're pescatarian. We realize our pet is going to eat meat, but we don't handle it very often. So here are the meats we feel comfortable handling. And so allowing that collaboration to have space. Because I don't want anyone thinking I have all the answers, because I don't, because I need to know about you and your pet. Because some of the best patient outcomes I've seen happen before is when there's been collaboration with the pet and the veterinarian. And then what's even better is if we can make it happen is if all the veterinarians are in collaboration, the general practitioner, me, or maybe I am the general caregiver for this pet too, if there's a specialist involved. But that takes everyone having to be open-minded. And so I've had pet parents be like, will you talk to the specialist? I'm like, I'm happy to if they're open-minded to hear my approach. What I'm not trying to do is convert them to practice like I am. But if they're going to hold space that this is my approach, absolutely. If they're not, then let's just both stay in our lane. And because everyone can bring something to the table. And I think pet parents, you as a pet parent can bring a lot to the table because you know your pet best. And that's where I step in to see where we can help bridge the gaps and the things that you don't know and how to support them. So when people ask me, or when pet parents ask me what I've learned in working in over 100 different hospitals, and I feel like that provides a lot of value because I've seen so much. I'm not stuck in one way versus the other. I'm not closed-minded because I only have access to these medications and I better just use these medications because this is what's in the inventory and we don't want inventory to go bad because it costs money. So let's just use this and let's not think outside the box. I don't think about the buildings. I think about the people. I think about the pets. I think about previous doctors who's mentored me and ones that I meet along the way. I've been out 12 years and I'm still learning. I still want to learn. I don't know everything now. I don't want to know everything now at 12 years. Medicine evolves too. I've had technicians teach me everything. And you know who's taught me the most? Your pets. They're the ones who've taught me the most. They've taught me to be ready for curveballs, to think outside the box, to be patient, to think in a collaborative way, to think creatively. And every family that has trusted me with their pet, those are the experiences that have shaped the veterinarian that I am and the veterinarian I will continue to be. Veterinary medicine isn't about choosing like a side, like politics, or choosing a religion. It is not having to choose necessarily between conventional and holistic, although sometimes I will say, depending on what we're doing, is sometimes you do need to commit. But it's not about abandoning one or bashing one. It's about choosing curiosity over assumptions. It's about choosing to ask why over just being handed a prescription. It is collaboration. It is personalized care over one size fits all. And I really want to thank you for joining me today and letting me kind of share this perspective. And I really look forward to seeing you on the next episode.